Okay, and I guess where this changes, where we get the bridge between people not having healthcare and having healthcare and the introduction of the NHS, is when the Second World War occurs. Because the government can't suddenly turn around to people who are either injured in the war or especially those that are bombed through no fault of their own, that they're not going to receive healthcare. There would have been a massive public outrage if that happened and people would have refused to do things for the government. So we got a system where the government has to provide during the war some kind of emergency care for those people, and of course that has to be free. Now, the scale of the Second World War and the amount of bombings, and the amount of injuries, and the amount of people that needed extra hospital care meant that your government has to basically provide quite a large scale of things. So there's 1,000 new operating theatres. We see sort of tens of thousands of extra hospital beds being created. Now, people didn't just not notice that. And when the mood of the people during the war changes, because it does from about certainly 1942 onwards, where people start thinking, actually, we want something back. One of the things that they realise is that actually the infrastructure or the things that are needed to introduce a good healthcare system are kind of already there, because the government has had to introduce them during the Second World War for emergency care. So people think, well, actually, maybe it's not such a big step anymore for everyone after the war to have free healthcare, because during the war, a lot of the injured did have free healthcare. So the war is really important as an event because it's the gap between where people have to pay for it and there's no reason to change that, to suddenly where during the Second World War the government has to provide provision for people, and that's almost the bridge between having no healthcare and the NHS.